idea behind it is to look at the internal structures of materials. Okay, they can be biological tissues, they can be whole organs if they are, but organs have to be smaller in dimensions, such as the tooth and the bone, and primarily that's what it's meant for, to look at the internal structures. So what this particular one does is, if you were to go and look at a clinical radiograph, right, it's basically a two-dimensional projection of the whole system. Look, as the way we stand, we get a two-dimensional projection of ourselves on the X-ray film. Whereas this one, what it does is, it collects all those projections, the two-dimensional projections, in 360 degrees, okay, by rotating the specimen, and it puts all those projections together and creates a three-dimensional object for you, much like a complete system, okay, a complete object. And then what you can do is you can go through the slices, slice by slice. So it's called as virtual histology compared to the conventional histology, which is a parallel complementary system that people normally tend to use for biology to identify different types of molecules and tissues and things like that. I don't think this completely replaces the conventional way of doing it, because that still is very important for biology. But this one provides you with, once again, a good three-dimensional outlook. And then again, it also tells you, because radiation is basically a function of the various mineral contents that are there in the body. So if you have a highly absorbing, X-ray absorbing substance in your body, then you'll end up seeing it as a radio-opaque material. And if you have a very transparent one, which means the X-rays are going through, then it's radio-transparent or translucent. And so basically this one here, what it does is, besides the structure, the internal structure, it also gives you those density variations. In this particular one, the reason why it's a little bit on the more important side is because it's meant for School of Dentistry. It comes in as a shared instrumentation. Okay, so it's mainly for the School of Dentistry, and also for any other user that would just basically like to come and use it to understand about their own, whatever might their research efforts be. We also have a strong association with the Department of Orthopedic Surgery, and there are at least 3 to 4 PIs that have come in as co-investigators on the grant. And how does it enhance the current systems that we have? We do a lot of imaging here, so it's much like going with the philosophy that seeing is believing. So what we do is we do a lot of high-resolution microscopy using different imaging modalities. You use mechanical probes to look at structures, you use electron beams to look at structures, and now you have an X-ray that you're using, a nice focused X-ray that you're using to look at internal structures of materials. So this basically complements many other imaging modalities that we have. So as far as my work is concerned, like I had said, since it went in as a shared instrumentation grant, the way the grant was written is to present all the work that is going on, or most of the predominant work that's going on within the School of Dentistry and Department of Orthopedic Surgery. And so having said that, obviously, I mean, the NIH has recognized it as to be being vital-piece of science that's being put forth by most of the researchers here at UCSF. So I think it's definitely highly regarded, and not just that, they also see it as a good tool to the already existing tools that we have here, which basically can be extended as a part of your second question, which is a complementary system to most of the things that are being done here.